President Trump is vowing to combat the growing opioid crisis. Listen.
The opioid crisis is an emergency, and I'm saying officially right now it is an emergency. It's a national emergency. We're going to spend a lot of time, a lot of effort, and a lot of money on the opioid crisis.
Joining me now to discuss is Fox News Medical 18's Dr. Marc Siegel. Thank you, Dr. Siegel, for being here.
Great to see you.
Great to see you. What does that mean, national emergency? What does that mean for all of us?
You know, it means he can bring to bear a lot of forces here that can really help. Law enforcement to get drug traffickers put in prison, enforcing the border, he can use funds for that. Education for doctors, mandatory education, which we're going to talk about how important that is. Funding for state and local agencies to better coordinate with the DEA, how to clamp down on this problem. And getting the U.S. public forces involved. The public health forces that are under HHS and Tom Price can go out into rural areas and help combat it there.
So who or what is to blame for this problem?
Well, I started talking about doctors with this because, you know, there's been a lot of criticism of pharmaceutical companies and the FDA and too many drugs on the market. But when you really think about it, who writes these prescriptions? It's physicians. And 50% of physicians writing it, Ainsley, are primary care doctors, not even pain specialists, not even back specialists, you know. Or the key problem, and we were talking about this, is they give out too many pills. So you go for a dental procedure. Instead of getting 2 days of Percocet, you get 30 days. Or you go for a surgical procedure, a back operation. Somebody gives you 120 pills. And you know what happens then?
They're just prescribing too many pills?
Yeah, and then you get used to them. You get used to them, and then the next thing you know, you're out there getting them on the street, and they're much more laced than you expected.
Then what do you do? I mean, how do you prevent someone from doctor shopping? When you're addicted, you've got to get that medicine, and they go from doctor to doctor to doctor. Some of those doc-in-a-boxes that are the fast, easy doctors, they'll prescribe a lot of drugs. They don't know your history. Hugely
important point. You just made a great point. And not only that, they get them out of the medicine cabinet. Somebody else's prescription. 259 million prescriptions were written for opioids in 2015. It's out of control. So 4 out of 5 people that are on heroin started with prescription drugs, and you know where they got them? 70% of the time it was somebody else's prescription. If I'm writing for an opioid, I better consider that it may not even be my patient that ends up taking it.
So how is the president going to do anything about this? How does he intervene? What does he need to do to get these doctors maybe not to prescribe so many pills?
He helped a lot the other day by pointing out that prevention is key, because if we don't get this before it happens, getting addicts off of it is hugely difficult. So he's going to have to start by putting more regulations on the amount of prescription drugs you can get. How many opioids can you get? In Maine, it's only 7 days. That's got to be across the country. I had to take a mandatory course this year. New York State had for anybody getting up for renewal of their license. We need education. Doctors need to see in front of them how much damage this can do, whether they're being used appropriately.
So we need to be proactive and not reactive.
Yeah, absolutely.
Right. Thank you, Dr. Siegel.
Good to see you.
Good to see you.